education in health is very critical. It is very shameful at a time and age as this that our doctors really are behind on their knowledge of medicine because they do not have the current modes of learning. And also the ambulance system, as our able lecture was given by the professor, the inter-tier referral system is very critical, and we have that established as well. We need to make ethics and etiquette a very compulsory part of our health education, because one of our problems in the state is the apathy of healthcare workers. The way we treat patients is totally different from the way we treat families that come to visit us in our hospital. On this note, I want to just bring out some highlights that I wish for this august body to consider. And that is for us as a government to focus fully on the primary healthcare system as the infrastructure or background of any healthcare system. It is the bedrock on which any successful healthcare system should be built on. It is the one that is acceptable, accessible, and affordable for the people, the most common good to the most common, to the most people in the community. We need to leave secondary healthcare system alone as a government. But in the failure of the federal government to provide the standard care we need, a lot of state governments have had to step in and provide secondary and tertiary care for their people. If we want to get it right as a party, making it to the national level, we need to step away from secondary healthcare system and let the private sector work with us in establishing that. And that's what we have at our Cardiac Renal Center in Bagada in Lagos State, wherein it is operated, is built, operated, and will be transferred to us by a private entity. All Nigerians that were based in the United States of America, they've now come home to help us with our healthcare system. And this we have found has reversed the brain drain that we have, and Lagos State is moving ahead with a brain gain of our international resources. The tertiary healthcare system must focus on research development, must focus on eliciting all the needs of the different states and bring about a common ground for the different states to operate, giving them flexibility to adapt to their various states' needs. We need to increase budgetary allocation for health. A lot of the developed countries have at least 15% of their budget allocated to health. Lagos State is still struggling, but we are at 8.5% come next year's budget. And this is very critical because of social medicine is what primary healthcare is about. We need to empower our educators with more modern information and technologies to keep our providers up to date and be able to provide state-of-the-art care for us to keep up with the trends in the world. Data management is very critical. If we don't know how many people we're giving what to, we wouldn't know how much we're giving to them. A census at this time is very critical. I hear that we're 170 million people strong, but where are we? How are we distributed? Which states need more and which states don't need as much? We talk about the establishment of long-term strategic plan, which we have in Lagos State, that helps us year in, year out to assess what we have in place, to see what is working and sustain it, and allow for evolution and innovations with the changes in our times. Also, the remunerations of our healthcare workers. It is important to understand that they are a specialized group of people. They are at the front line of a kind of a risk, which we're now seeing with Ebola. Ebola claims our healthcare workers first before anybody else. And we, as a state, are looking at the issue of providing health insurance, hazard insurance for our healthcare workers, because they're frontliners and take on the risk of being exposed to diseases. We also want to look at how to promote our healthcare workers. It should be by qualification and performance, and not just automatic civil service growth that moves you from one step to another level without cognizance for your contribution to the healthcare system. emphasis needs to be made on community involvement, especially at the grassroots level, to make APC health policy statements felt by the very people that need them, for them to embrace the party as a truly listening, progressive party. Thank you very much.